Okay, everybody, the last thing we're going to talk about is lead poisoning. Lead poisoning is in chapter 32. It starts around page 896. Lead poisoning assessment. The most important factor when it comes to lead poisoning is related to the child's environment. We want to investigate a history of pica, which again is an ingestion of non-nutritive substances. You want to evaluate the parent-child relationship. Again, the big thing here would be supervision. Our kids putting toys in their mouth? Do they live in an old home where there's lead paint? We'll kind of talk about some of those things as well. Chronic lead poisoning, the assessment data is really vague. They'll have crampy abdominal pain, constipation, anorexia and vomiting, listlessness, neurologic issues, permanent irreversible damage, seizures, learning disability, hyperactivity, blindness, paralysis. They'll have issues with their kidneys. Lead is a heavy metal excreted by the kidneys, causes damage to the cells of the proximal tubules. You'll see glucosemia, proteinuria, ketonuria, a decrease in vitamin D, and those things are reversible as long as we catch the lead poisoning and we correct it. Hematologic system is also affected, prevents formation of hemoglobin. As a result, we'll have anemia, and again, it is reversible if we catch it early enough. Some other assessment data, you could see blood lead lines. That is a bluish black line on gums. X-rays will show lead lines in long bones and flecks of lead in the GI tract. And also we can look at the serum lead levels as well to see how much lead is detected in their blood. If you guys look at page 898, figure 32.15, it talks about the main effects of lead on the body systems. Again, I talked about the three systems, the hematologic, renal, and neuro. So you can look at that. That diagram lays things out nicely. Oh, sorry, I didn't know I could have been clicking. Your nursing diagnoses here that we worry about is risk for injury, multi-system related to retained lead, the systems that we just talked about, pain related to lead poisoning and its treatment, and knowledge deficit related to etiology of lead poisoning. So the first thing we'll talk about is promoting the excretion of lead and preventing reingestion of lead. We basically have to start chelation therapy, so we will administer a chelating agent per MD order. It can be given via a series of painful deep IM injections. We dose it at 75 mg per kg per day, and it's given twice a day for 5 days. Again, it goes deep in the muscle. It's not pleasant for kids. And typically with kids, you can do something once, no problem, but then they realize that it is painful, it's scary. And when you go in to do your subsequent injections, it will be an issue. Again, think back to our very first week of class when we were face-to-face. We talk about some of the ways that we can help with painful treatments. We would want to make sure we're monitoring kidney function carefully, maintaining oral intake of fluid. We would want to initiate seizure precautions. Don't forget, it's affecting the neurologic system. In children with low levels, we can give an oral medication. So I guess it's important to point out the degree of how much lead is in their system will drive the treatment. If it's low levels, we can give them oral medication. And then again, the more heavier lead in the system, we would do some chelation therapy. If we have a kid that does have lead poisoning, we do need to report that to the health department. We need to figure out where they were getting this lead from. and we need to eliminate that source from their environment. If there's other kids in the home or other family members, we would want to screen them as well and see what their lead level is. All right, our next goal is assist children to cope with multiple painful injections. Again, we talked about if the treatment is that deep IM, we need to make sure we're preparing the child for treatment regimen. We need to make sure they know that this isn't a punishment. I don't know if any of you ever heard kids in the hospital or the pediatrician's office with their parents, or you might even hear parents just say this in the grocery store. If you don't behave, you're going to get an injection. They usually say shot, but we know we shouldn't use that word shot with kids because they actually think they're going to get shot. So sometimes parents use that as a punishment or as like a fear factor to keep the kids in a line. We don't want to do that. You would want to rotate your injection sites. You would want to use a numbing agent prior to the injection. After the injection, warm soaks or a warm bath to help ease the pain at the injection site. The child might, on their own, just limit gross muscle activity. It's going to hurt when they actually are putting weight and those muscles are being engaged. Again, kids can get angry when they have to go through this type of procedure. So we want to make sure we're giving them a appropriate outlet for their anger, fear, frustration. A pounding board, you know, they're toys where they can pound on something with a hammer. Clay that they can really sink their hands in and kind of mold. You could use a punching bag. I've never seen a punching bag used clinically, but there is that option. And then again, making sure, if you think back to that first week we were together, let them play with the syringes, make sure they're comfortable with the equipment. Obviously, there would be no needles attached to that syringe while they were playing with it. The other thing, some of the other things we need to teach about is stress to the parents that removing lead is the only way to prevent permanent, irreversible neurologic damage as long as that has not already occurred. And teach that the action of the chelating agent is to bind with the lead and to promote its excretion via the kidneys. Your evaluation or outcome criteria is that the lead is successfully removed from the child's body without permanent damage, and we have no further episodes of lead poisoning. Their pain is controlled, and the family has identified and removes sources of lead from the home. All right, and again, you'll find all of that information in chapter 32, starting on page 896. It kind of hops around a little bit. All right, that is the end of our GI lecture. If you guys have any questions, make sure you let me know.